So we have Stephen Burton here, who uses he, they pronouns. He's a recent graduate of the Colorado School of Public Health with a Master of Public Health and concentration in community health education. Stephen currently leads the newly opened LGBTQ+ hub on the CU Anschutz Medical Campus. And their passion is teaching people about behaviors that promote well-being and addressing intersectionality factors that lead to health disparities in marginalized communities. With that, Stephen, I'll pass it over to you. Thanks so much for joining us today.
So today I'll be talking about the LGBTQ+ hub and what we do on the CU Anschutz campus, but also due to this being like a social determinants of health group, I will briefly talk about just some LGBTQ+ social determinants of health and ways that we can all be a part in improving our society and making it more inclusive for everyone. So with that being said, I like to just go over some quick group norms for pretty much any of my presentations. So I like to use the be smarter than your phone. If you can, just mute your phone, just put those to the side and be here, be engaged. Questions. At any moment, you're more than welcome to either put a question in the chat or raise your hand. I might not be able to see your hand because I have like the video is kind of small. So if you could just either come off of mute or put it in the chat, I'll try to get it from there. In addition, I like to utilize the Vegas rule, which basically says what is said here stays here, but what is learned here leaves here. So more so, we shouldn't be talking about anyone's personal life outside of this space. But if anyone feels comfortable talking about their lived experiences in this space, you're welcome to do so. And you can take those learnings and educations and materials from today and take that with you. I always encourage those to laugh out loud. I think it's a great way to learn. I want us to share the airtime. I think Tess told me around 20-25 minutes of talking, and that we'll have some Q&A at the end. But once again, you're welcome to ask questions at any moment. And then the most important golden rule for me that I like to emphasize is to reserve the right to change your mind. A lot of us grow up in different backgrounds, different environments, different cultures. So we might have some biases. And so I encourage us to be open to knowing that we can change some of those biases that we do have. Okay. Just going over some of the learning objectives today, I do want to give an overview of the LGBTQ+ hub. I want to talk about some of the impacts, how the hub has an impact on the sense of belonging and support for those on campus and those off campus as well. I want to provide an opportunity to talk about the collaborations that we have done previously and ones that have been going forward, and also new potential opportunities of collaboration. And then I do want to give a brief review of just the social constructs of cisgender, sexual orientation, things like that to make sure we understand. And then have a brief review of just some social determinants of health. Not too much, but just enough so that we can understand ways that we can improve. And that being said, so the LGBTQ+ hub, for those that are not familiar, we do have a physical location on the CU Anschutz campus. It's located in Education 2 North, room 2101. We're open Monday, Wednesday, Friday for like in person if you want to actually go into the space from 8 to 5 p.m. If you wanted to meet on Tuesday or Thursday, we share the space with the Oasis space. So it's possible, we just have to like do a little bit of coordination with that. I do have our email right here if you ever wanted to reach out to us, and I'll make sure to provide this after today's presentation. If you have a chance to scan this QR code, I'll also provide these links at the end of today's presentation. This will take you to the website that Tessa Carson put together. It's an absolutely wonderful website. Once again, thank you so much for that. And yes, and so with that, we'll kind of break down a little bit more what we actually do within the hub. But I do want to emphasize that it's open to all faculty, students, and staff in the community. We're specifically trying to target the Aurora community, but we're also open to Denver and Boulder and other areas like that, but really emphasizing bringing more LGBTQ+ services to the Aurora community. And with that, I want to talk about our mission to really like break this down and make sure we all understand what we are pushing to move forward with, and also kind of relates to our vision as well. So our mission is to create and maintain an inclusive campus environment for LGBTQ+ and allied students, faculty, staff, patients, and visitors on campus and within the Aurora community. We do that by multiple ways, but I want to emphasize on the students, faculty, staff, patients, and visitors. So as most of us all know, the Anschutz campus has that medical university aspect. So we do have students, we have faculty, staff, and then we have the patients and visitors that come into our space, that share that space with us. And so with that, we want to make sure that everyone has a sense of belonging, a sense of identity, a place, a feeling, a community. And so that's why we emphasize working with pretty much everyone that we can. And so it's a little bit different in ways that we do with patients and visitors, but we do mainly focus on students, faculty, and staff on campus. And I'll talk more about the collaboration and how we interact with patients and visitors and things like that. But we do all of this in a sense of promoting visibility, awareness, and a sense of community. For those that don't know, the hub officially opened in the spring of last year, 2021. But we initially started this entire thing back in the fall of 2020. And that was based off hearing from a lot of individuals within the LGBTQ plus community and those of allied community of a sense of feeling invisible, of feeling isolated, of feeling that they were not recognized on the Anschutz campus. If you're familiar with the CU campuses, we have the CU Boulder, Denver, Colorado Springs, and Anschutz campus. The Anschutz campus was one of the last CU system campuses to get an LGBTQ plus focused program for the entire campus. So before that, just people were kind of left on their own. It's an unfortunate history in the sense of the Anschutz campus, but now that we have the hub, we're able to address that feeling of isolation. And I'll talk about ways we do that a little bit later. And also we want to promote awareness. A lot of individuals, unfortunately on the Anschutz campus, we have a very heteronormative mindset. If you're not familiar with that word, it basically means that people have the assumption that everyone is going to be straight and that everyone is going to be cisgender, or that their gender is going to align to what was given to them at birth. And so with that mentality, we have a tendency as in our society to erase those that are LGBTQ plus. And so with the hub, we're trying to promote awareness, letting people know that's completely okay to be who you are. We need to celebrate it. There's no need to feel any guilt about it, and really promoting that. And then that sense of community, I'll get to that momentarily as well. And then we're also connecting LGBTQ plus students, faculty, and staff with peer-to-peer support and community resources. On the peer-to-peer support, I'll talk about a little bit more later, but it's only offered to students, faculty, and staff. It's not open to the community just due to limited capacity to take on the entire community with that program. And then we provide educations about LGBTQ plus community. That's with presentations, workshops, panel discussion. There's a wide variety of ways of doing that. That's open to any department, school on campus, and also any organization outside the Anschutz campus can also request educations, panel discussions, and things like that. And then we establish a repository for our health research and competent patient care. Most of all of this is within our website that you can go to and look through to see where all this repository information is. It's constantly being updated. So if you have some research that you would like to add to our website, definitely reach out to me and I'll be happy to add it or get it added to me. I won't personally do it. Tess is a wonderful person who does that. And then advocating for LGBTQ plus interests, including recruitment and retention. This including for students, faculty and staff, and those application forms for anyone that's coming into campus, making sure that those forms are inclusive of the LGBTQ plus community. Unfortunately, a lot of them are not as updated. And so we're constantly working on that to look at any policy application process that we can. And then finally, we're creating intentional partnerships to provide direct services to LGBTQ plus people on campus in the Aurora community. Within the hub, we have an advisory committee that's open to all faculty, students, and staff in the community. If you're in Aurora or Denver, wherever you want to be. We even have some people outside of Colorado that's also part of that advisory committee. We meet on the third Wednesday of each month from 1 to 2 p.m. Sometimes that kind of fluctuates and changes depending on people's availability, but for the next couple of months, it will be on the third Wednesday from 1 to 2 p.m. We do a hybrid approach for in-person or virtual for those that cannot make it in person. There we go. And then just a breakdown about our programs and services. We put them into 4 categories to really help people conceptualize it all. And those are community events, resources and support, education, advocacy, and research. When we talk about community events, we have like welcome back to campus events in the fall and spring, having different types of monthly groups such as journaling groups, sport leagues, things like that. We have an ambassador program, a listserv that basically a newsletter that anyone is welcome to join. Within our resource and support for that peer-to-peer mentoring, coaching, this is open to students, faculty, and staff only, so not the community, as I mentioned earlier. And this is specifically around individuals that are LGBTQ+, that are either a student, that are faculty, that's going through their academic career or just their career in general, and want to have someone to talk to as they go through that process. We usually do about a 6-month program, but it can fluctuate depending on someone's availability. It's free to sign up for. You can check our website to do that as well. And then we have our LGBTQ+ resource directory within this as well. And going back to the education advocacy, as I mentioned, around workshops, presentations, and panel discussions, we also host an annual conference that'll be on the second Friday in October. We have an education series that you can request if it's like a month long, 2 months long, things like that. And then moving on to the, also, if you have within your own program, you need your curriculum to be updated, we're happy to look over that as well. And then around research, it's a little bit harder to do because a lot of the software we have is like a third-party vendor that's kind of over that. So we're trying to update a lot of the research portals within the Anschutz campus, but it's just taking a little bit of time to do so. And with that, we're just trying to centralize a lot of the LGBTQ+ research specifically happening on campus and making sure it's easy for those that want to get involved in those to get involved. If you're doing a practical capstone, you're welcome to do so with the hub. And then also if you're into doing research grants and things like that, you can also reach out to us and we're happy to connect you. And that being said, I wanted to talk about how the LGBTQ+ impacts a sense of belonging and support. So basically, to sum it all up, it's creating that centralized one-stop shop on campus. As most of you may know, like a lot of the Anschutz campus and resources we have are almost kind of isolated to their departments. Not a lot of people communicate. So that's why having the hub, we try to centralize all the information. Sorry. Centralize all the information so individuals can go to one spot to find, if they want to do research, or they're looking to communicate with someone, if they want to get their research out to other people, you can come to our website, you can email me. We're happy to connect you with those services. And we also do this by addressing the isolation felt by the LGBTQ+ community. This is both in regards to students, the faculty, and staff. It's been absolutely wonderful over the last 2 years to see so many people embracing their identities for the first time in their career, being like, hey, I'm lesbian or I'm bisexual, and feeling a lot of pride in that, not feeling ashamed about that on the Anschutz campus. So it's wonderful to see that change. And helping each department create inclusive, safe spaces, and helping departments create LGBTQ+ support groups. We've had quite a few different student groups, faculty and staff groups be like, hey, we want to create our own LGBTQ+ support group within our department. Can you help us do that? And I'm more than happy to do so. If you yourself are like, hey, we might need this, happy to do so as well. And then providing those trainings on how to integrate LGBTQ+ topics into the curriculum and policies. A lot of our policies, unfortunately, are still not up to date. So it's a lot of work. If you see something in your policy, in your own department, you're happy to reach out to me. I'm happy to work on changing that, updating that. And then increasing community trust of healthcare establishments. Unfortunately, if you know anything about LGBTQ+ health disparities, also in the LGBTQ+ community is a lot of mistrust of the healthcare system due to basically providers not being, having cultural humility, cultural understanding of this community. And there's more of just flat out discrimination that they face as well. So there's a lot of mistrust. And so we're addressing that, trying to make the Anschutz campus more safe space so that individuals feel comfortable coming here. In the past, a lot of people would go to Denver and not even Aurora, specifically around LGBTQ+ services. A lot of this has changed over the past few years, and we're hoping to continue with that change. People to feel comfortable in their own community. And then finally, just providing those gender affirming services and resources. I'll talk more about why it's really important to have gender affirming services, coming up shortly. And then finally, I want to talk about some ways that to collaborate. These are some of the ones that we've recently collaborated with, such as the School of Dental Medicine, the Colorado School of Public Health, School of Medicine, College of Nursing, Graduate School. Also, when it comes to community events, we try to make sure to have the Anschutz campus show up in person. So like the Denver Pride, the Aurora Pride, the City of Aurora Health, LGBTQ plus Health Summit, showing up in the community. We can have a vendor booth there. We can also be part of a parade, things like that. Partnering together with DAVA or the Downtown Aurora Visual Arts. The City of Aurora, we do a lot of work with them as well. Different music venues, such as like the Mile High Freedom Band. There's different student groups and research projects that reach out to the hub in ways of like, hey, we have this project coming up. We want to email blast this or get more people to be involved. And so if you yourself have a project coming up, you're like, hey, I need to get some participants, or hey, I just want to engage with this community, I'm not sure how to get started, reach out to me, happy to do so and get you connected. So there's multiple ways of collaborating, but specifically if you're trying to get engaged with the LGBTQ plus community on the CU Anschutz campus, I definitely recommend the hub as a first stop to kind of figure out where to go. And then with that, I definitely wanted to emphasize this. I think most of us have seen this before, but I really like this image in regards of what the hub is doing, of us really trying to promote justice, not just equity or even equality. So when you think of equality, you might think of individuals just getting what you get, having that same ladder. Someone might be left out, someone might be getting it, what they're looking for, getting the resources, services, but that's when it comes to equality, everyone get the same. It doesn't really work out. When you think of the equity, you're addressing that and providing more resources for those that might need it, and those that don't need it, you just don't need it. But I like for the hub, when we think about that, is focusing on the system itself and addressing it. I know this image is a little hard to see, but they fixed the tree, which was one of the biggest issues because it was leaning over, and more so that fixing the system itself to improve the LGBTQ plus, specifically around health. And that can be mental health, physical health. There's multiple ways. I'll talk about that shortly. But just keep that in mind. We're really pushing forward for that. And then just a brief review of the LGBTQ plus 101. I really like to emphasize cultural humility compared to cultural competency. Cultural competency is basically this mindset that you know everything there is to know, and you're not really challenging yourself as much. I encourage us to have cultural humility when we talk about LGBTQ plus. It's that lifelong learning and critical self-reflection that we have. We're recognizing and challenging power imbalances. A lot of this is around social biases and social norms that we have in society, such as a norm, a societal norm of binary genders. Gender is not on a binary. There's more than just two genders, and things like that's just an example to talk about. And then also having societal accountability, holding not just ourselves, but those around us accountable so that we can create a more inclusive space for the LGBTQ plus community. Then I want to talk about some of the health disparities, since definitely we're talking about social determinants of health. With this graph right here showing that if you look at, say, go back to 1946, that we had a pretty smaller percentage of individuals that openly identified as LGBTQ plus, about 0.8%. And as you see, this is going up from 1946 to 1964, the baby boomers, Generation X, millennials, Generation Z. We're seeing that more people are openly identified as LGBTQ plus. It's not going down, they're not going away. So we need to make sure that we are addressing the health disparities that the community face, which I will talk about shortly. We want to make sure we provide services that is keeping up with this community. And then just a few examples of some of the health disparities and inequities they face. For example, lesbians are less likely to get preventative services for cancer. Lesbian and bisexual females are more likely to be overweight or obese. A lot of this goes back to them, a mistrust of the healthcare system. A lot of them don't want to openly identify as lesbian or bisexual to their providers because they fear that they're going to receive less care compared to if they were to say they were straight. The elderly LGBTQ plus community face additional barriers to health because of isolation and lack of social services and culturally competent providers. I really encourage you, if you can, research what happens in our society to elderly LGBTQ plus. We need to do better providing services for them. And then gay, bisexual, and other men who have sex with men, they have higher rates of HIV. If you know anything about the AIDS pandemic, or if you don't, it's unfortunate, but in our society, we have a tendency not to provide as many resources for this community, and they do have higher rates of health disparities in certain regards. And then around 40% of homeless youth are LGBTQ+. That is absolutely mind-boggling and frustrating, but a huge population of homeless youth are LGBTQ+. LGBTQ+ community are refused medical care from medical providers all the time. Sometimes they're verbally or even physically assaulted by medical providers. That's not okay at all. We need to address that. And then LGBTQ+ youth are 2 to 3 times more likely to attempt suicide. And I highlighted this in red at the bottom just to mention that the transgender community have higher numbers in all of these above. If any research you do for this, you will see just startling, mind-boggling, horrible statistics for the transgender community when it comes to health disparities that are just not being addressed. And it just leads to more and more. And then I wanted to include this image just to kind of give a visual of what happens if we do not acknowledge disparities in these communities. So this is from the 1980 San Francisco Men's Choir. If you know anything about the AIDS pandemic in the 80s, basically the government just did not care what happened to this community. They called AIDS or HIV like gay cancer. They just did not care. And so those that are in white are those that survived. I think this photo was taken in 1993, and everyone in black like died. And this is just one image of a community that was completely wiped out. And I put this in here so that we emphasize we cannot just ignore these health disparities. We have to address them. We have to learn about them. We have to make sure we capture data about them. And then finally, just some sexual orientation, gender identity importance is that if you're not counted, you are discounted. If you look back to that previous photo, the government basically completely ignoring this community. We need to make sure we're addressing that. Data collection allows us to tell the LGBTQ+ story. Make sure if you're doing surveys that you're including the LGBTQ+ into those surveys. Creating those safe space and affirming this community, identifying disparities, securing funding. It allows us to inform public policies and laws, allows us to do evaluation and ethical responsibility and legal compliances. And finally, just want to go over some affirmative terminology for us. Instead of saying transgender or transgender, you can say transgender. Instead of saying transsexual, say trans man, trans woman. Instead of saying hermaphrodite, say intersex or difference in sex development. Instead of asking someone what's your real name, you can ask them what name would you like to be used for legal or insurance purpose. Instead of saying he, she, it is completely offensive. Don't do it, it's not funny, don't do it. You can ask somebody what pronouns would you like me to use? Instead of sexual preference, you can say sexual orientation. Instead of homosexual, you can say gay or lesbian. Homosexual has a very old like mental health history behind that word. So it's more encouraged to just say gay or lesbian. And then just want to go back over the objectives, just going over what the hub is. You can always reach out to us via email. We have a couple of different websites. You can find all of those on our main website. And then talk about some of the impacts of the sense of belonging and support, offering an opportunity for collaboration with us, and then kind of go over some of the sex, gender, sexuality, and review of the LGBTQ+ social determinants of health. That being said, I'd like to end my presentation in a quote, and the one I picked was from Mark Angel. I'm not Mark Angel, I'm not sure. So don't be lazy and make judgments about people. Be kind, ask about their stories, listen, be humble, be open, be teachable, be a good neighbor. I want to thank you all. These are our website for that, and then the resources if anyone wants to look up those. But want to stop for some Q&A if we have some time.
Thank you, Stephen. I think we do have time for a couple questions. Does anyone have a question for Stephen?
Hi, Stephen. My name is Sarah Young. I'm a member outreach coordinator with DentaQuest, and we oversee the dental benefits for Medicaid and CHP+. And I was wondering if you have an existing resource that we could specifically disseminate to our dental providers to be able to help them to create a more LGBTQ+ environment for their practice, how they can integrate that into their training. Is there something like that that already exists or that we could adapt for our purposes here in Colorado?
So previously, like even our school of dental medicine, they reached out in regards to this as well, of trying to really update everything. Unfortunately, what we've done, not necessarily unfortunate, but fortunately, what we've done is to reach out to them specifically to find out what it is that they need to kind of custom made it to their needs. So we don't have anything that's just a standard, like this will work for everyone just yet. We are in the works of creating that. So I do want to put that out there. But if you wanted to, you could reach out, let me know like, hey, we want to have some type of trainings or our intake form, stuff like that needs to be updated. So right now it's kind of by request, but we are in the process of creating that standard that anyone can kind of look through and pick and choose what best fits their scenario.
That's great. Well, I'll stay tuned because it's very much needed.
Okay. Yeah.
And I have a similar question with regards to just employers in general. I work with a lot of local employers. Many of them are in Aurora. So I was just wondering, could an employer request to have a presentation done, or could we maybe organize a presentation and invite a bunch of employers to it on this topic?
Yeah. So what's something we also do is open up we have at different times, some of our presentation that's just open to anyone that's on the Anschutz campus and also anyone in the community. And outside of that, if you're like, these times don't work for me, this is my day and time that works, you can request a hub to come in on whatever, as long as you have a reasonable size. We don't want to like,
Sure.
for like 1 or 2 people. More in those cases, we want to invite to the larger presentations. But if you have a group of people within your own separate organization, you're more than willing or happy to reach out to us. And I'm happy to provide that presentation for you.
Thanks. And a follow-up, would it be only for like Aurora employers, or what's your boundaries?
If it's virtual, anywhere. So
Okay.
anyone is welcome. Like, I wouldn't be able to like fly to New York or something.
All expense paid.
Nice.
Thank you.
Thank you for this presentation. We work really hard. So like I said earlier, I'm Najwa with Children's Hospital. We work with families that are struggling. We do all the resource mapping for them, and we are starting to come across a lot of young adults and parents that need more resource mapping, and we want to be mindful and culturally thoughtful about that. And is there, I mean, I know you said that you'll train, but do you guys do training that's a little bit more in depth, wrapped around resources that are available? Like I have a team of 22, and this would be so helpful for them to be able at least to be like, I really don't know where to go, but at least I can start here and be thoughtful and mindful of the people that need support on our caseloads. So we do all the resource mapping for our families that are struggling financially. Do you guys do that? Because I'll be the first one to say, can I sign up? Because there's only 3 or 4 of us that are patient navigator certified through the state of Colorado with the LGBTQ plus community. And we're still not, I mean, I'm one of them, and I still like this much information know in comparison to what's really out there. And so will you come help us?
Yes. So with that, like we have a list of trainings that's already available on the Hub website. But outside of that, if you're like, I need this, as you mentioned, this specific one, definitely reach out to us and we can custom make a training that regards to that, to your request. And then if you need something that's more clinical based, that's like different types of hormones and stuff like that.
No. We're non-clinical. My team is all non-clinical, but are those trainings like they can ask questions in live and they can have conversations with everybody?
Yes. So once it's completely what you're looking for, and we tailor it to that.
Okay, great. That's awesome.
Yeah, you could request all of that via our website. And then I can email back and forth that way.
Well, thank you all so much. Thank you, Stephen. We really appreciate that great information.
Thanks, everybody. Our second presenter is Amal Kassir with Muslim Youth for Positive Impact. She is the Mental Wellness Program Manager, and I know I'm excited to hear about all of the great services and resources that Muslim Youth for Positive Impact has. Thanks, Amal, for being here.
Hi, thank you so much, Julia, for the introduction. It's such a pleasure to see everyone's names and a familiar face from the community. It's great to see you, Najwa. All right, Bismillah. As you said, my name is Amal. My name is Hope in Arabic. I was born and raised in Denver, but really spent most of my life Centennial, Aurora, right on the border between the two. So I left home and ended up coming back to Colorado in search of a way to really get to the grassroots that was a bit troubling to grow up in. I was 6 years old when 9/11 happened, and I was attending the private Islamic school in Aurora. And it really shaped our experience. And so what Muslim Youth for Positive Impact is doing is really sort of filling the gaps that we had to learn about as the American Muslim experience started unraveling over the last 50 years. So our main mission is to empower the youth with the Islamic identity and principles to make a positive impact on their communities, their environment, and relationships that promote responsible citizenship and stewardship. I'm going to go into really broadly the organization itself and then get into the reality of the Muslim mental health experience and what we're doing to cater to that reality. We have reactive and proactive programming, so we make sure we get to the issue before it unravels and make sure that we tackle what's in front of us. We have a lot of youth development work, so really nurturing resilience, confidence, and that inside experience that the youth are having as they're growing up in the United States. Of course, encouraging youth to give back. We know that service is the most powerful way to keep us connected, especially for marginalized people who tend to be alienated, disenfranchised. So this is the connector. Family support, ensuring that as we are serving the youth, we are serving those who are in their microsystems, empowering their parents to deal with these issues and to deal with what is new that they did not have, especially considering that a huge percentage of the people we serve are first generation Americans or refugees themselves. So we also have the social support, just really giving people just the opportunity to just have a good time, to belong in a community and to really build strong relationships that will last, especially when a calamity strikes, whether it's a fire in Boulder or a suicide in the community. The MYPI family, we are getting so big, it's amazing. We started off with just doing like mother-daughter Sunday school type gathering events, getting people connected, having those conversations. Because again, we have two completely generations that are growing up and trying to build one home. So we have our executive admin team. We have our interns and ambassadors, 29 youth. We have so many youth on our advisory board. We have mentors and mentees. It's sprawled across Colorado, where it really has a gorgeous array of Muslims from all over. We have so many Africans. We have North Africans. We have Arabs. We have Southeast Asians. We have Indonesia, Cambodia. We have really a comprehensive representation, both in the mosques that we work with, as well as just the youth that show up who are also in the mosque. We have 4 major programs. We have our Adopt a Family program, our mentorship program, our mental wellness program, and Pathways to Success. I'm going to start with Pathways to Success. Providing Muslim youth with opportunities for career exploration, making sure that they have support on the college process, things like that, especially given that we have a low-income refugee community. And so the chances of success are not always in favor of those individuals. And so Pathways to Success was launched in fall 2020 to provide opportunities to explore what is out there, to actually interact with professionals, give access to individuals that, people might not have in their communities, and having ongoing support through that process. And it's beautiful because the feedback loop has brought individuals back into our mentorship program so that they're going back and serving after having been served. And the focus of this program is to make sure that there is a connection between generations, both in spiritual growth, mental well-being, educational, personal, professional, you name it. It trains mental health, or it trains mentors to provide the support and the guidance to their mentees so that they can have a life one, knowing how to talk to someone, because that tends to be a very difficult and stigmatized part. But two, ensuring that multi-generational connection is alive and well. And as I said, a lot of our mentees go on to become mentors in the next rounds. We are just about to start our newest mentorship round starting August 27th. We're going to be having a picnic, and with the new knowledge that has been surfacing, which I'm going to get to in just a little bit, we have added a very strong mental health component and just dealing with certain things that are so prominent in the community and so not talked about in the community. And so we're really honing in on equipping our mentors with just some of the skills to be able to scope out what might be taking place. And so the strength is really in the training that's developing. Next is our Adopt a Family program. The Adopt a Family program uses the minds, the help, the service of youth to really facilitate the transition for our refugee families to come into the United States. Colorado is a huge refugee intake state, and we are doing the best we can to serve a community that they're coming here with more than just suitcases. They're coming here packed with a lot of ideas and a lot of habits and changes that need to be facilitated. And having the youth serve has proven so profound in this process, both for the youth as well as for the individuals. Helping them become self-sufficient, back on their feet, and integrate into the community is the #1 mission. And once again, we have come and deduced a strong mental health need with this. So through that empowerment, as we help them make that transition, we use the youth, we assist them through a variety of different things. You can actually see right here. We have the youth ambassadors, so there's someone to call on for this sort of resource navigation. We have a resource center where you can actually go, and there's food and clothing and furniture, you name it, and you'll find that at Meshed Loss. And they have service days every I think once a month or twice a month. I'll have to double check on that. But we have food relief efforts, and we've made sure that due to transportation limits, that we can also deliver this type of work. Family assistance program in times of an emergency. You know, for example, we had a family who had 3 disabled youth who were all in their teenage years, and they were all in wheelchairs, and there was no way to get them around, you know, and so the community came together to be able to get them a van that would hold these wheelchairs and so on. So really responding to certain crises and needs on a relationship basis, knowing who we're serving, and not just having a one-size-fits-all solution, but really personalizing it. There's also the family sponsorship program, where it's not only the youth who are serving the families, but it's actually 2 families, refugee and non-refugee, coming together and building that relationship. Again, what it does just to the mental health has proven the ability to come out of that and then once again go back and serve your community. We do a lot of mentorship, a lot of teaching, a lot of training, from how to get a job to, you know, what is acceptable in the culture and all of these various things. So there's a lot of ways to get involved with this facet. But all of these various pieces have given birth to the mental wellness program. And the mental wellness program is a new addition to the MYPI programming. And it came out of the refugee, the Adopt a Family initiative, and then the mentorship program. We had our mentors coming and saying, look, these are some issues that are far beyond what we know how to deal with. Some things that are more severe, maybe something that's happening in the home. And so we realized that we really needed to take an intentional, curated approach to ensure that there were mental health services, that there was something that fit for the Muslim community. We know, I really loved the term that the speaker before me used about cultural humility, but there is a degree of cultural competency that is absolutely required for the Muslim community. One, because it is very different culture, but two, given the world population, the population is close to 2 billion. And so within that strangeness, there is also a lot of diversity. And there's going to be a lot of unique experiences for these individuals that will require the right kind of tailored services. And individuals must be well informed and trusted. An experience that we've had in the community is that someone will send a child to their mental health provider and they will not feel like their values are respected. And so now the parent will not let their kid get that type of help, for example, because it feels like a violation of the tradition. And so what do? Do we create the separation, or do we figure out how to have an all-encompassing approach? And so that's what MYPI is trying to do. We're combating the stigma. We're bringing forth dialogue and trying to build safe spaces to get the trust built between families, leaders, mental health providers, and most importantly, youth. We do welcome the entire community to be a part of the mission and make this impact with us, because there was a recent study in August 2021, last year, almost exactly a year ago. And the statistic is not on here, unfortunately, but it was found that Muslims in the United States have the highest rate of attempted suicide than any other minority. Now, once again, there's a big diversity within the Muslim community, but this, for a topic of suicide, which is absolutely not talked about, for that statistic to have come out was very shattering for us. And there were multiple situations of murder suicides that took place across the nation that made us realize that there was an issue, that there was a divide, and that Muslim youth are struggling. And so thankfully, there is this Muslim mental health movement that is taking place right now on a larger scale than it was before. We all know that people have been working towards the good all this time, but now it's been elevated. COVID really forced us to sort of see the reality inside the snow globe. And so there's substance use disorder, there's anxiety disorder, mood disorder, we have ADHD, we have adjustment disorders, so on. Once again, we are working with the refugee community. And so there is PTSD in the mix as well. There are physiological implications of just the stress and the transitions into the United States. And Muslim youth are struggling to balance their identities. There are higher levels of depression. There is a serious, chronic experience of not belonging. And we know from the studies, which again, the speaker before me touched base on that experience translated with the LGBTQ community, but the experience of not belonging can lead to a whole host of other troubles. So we found that 55% of Muslim high school students have experienced discrimination. I've experienced it, and most of the people around us actually have. 78% of college students. Oftentimes it'll be from a teacher or someone on the higher level as well, not just students and bullies of that sort. Visibly young Muslim women, of course, are going to experience more racism just because it's obvious. And the obvious is Muslim youth who experience this kind of marginalization are going to struggle with other mental health issues. And it's always a struggle when there's a lot of stigma in the community as well. So you're almost battling the reality and the attempt to pretend like it doesn't exist. And we know that with the parenting issue, to give you just a very specific example, my father came from Syria. And I mean, he grew up there in the 50s, the 60s, the 70s, and 1970 Syria looks a whole lot different from, Denver in the 80s. And so this transition, seeing what he saw there in a community where religion was prominent, whether it was Christian, Jewish, or Muslim, to a society where that's not the major emphasis. It was scary, it brought about fear and nervousness. And so there was no knowledge or bridge to go from parenting to that society into this society. And now we have a host of refugees who are coming with a big culture shock that's coming with it because there's no guidebook for this. And so by empowering the parents, we are able to support the youth, because at the end of the day, the youth are going to have their family first to lean on. 64% of the youth in the study said it was their family. But according to even our mentorship data, that's where the struggle is also born to begin with. Then it's the peers and the friends and the people around us. Then it's the schools and the religious study. We take an approach where we want to make sure that everything feeds back into the youth. This is a little bit of a crazy Jamboard that the team and I built, but we're integrating the imams of the mosques, the religious leaders, who are the front lines really for our fathers, to have an understanding of mental health. We are bringing in therapists and counselors, individuals who are versed in trauma, to be able to serve the youth with clinical provisions. And then we're using technology and information of like, here's the Muslim suicide hotline, and did you know you're not the only one? Using those kinds of resources, one, to just create access and awareness around the issue. And then of course, empowerment, using writing and workshops and expression and dialogue as a tool to really hone in and develop the identity experience and almost give the youth permission to be frustrated with it, to struggle with it. I always bring it back to the reality that, our fathers, a lot of my generation and the youth that come, when our families came from overseas to build the American dream, they were not afforded things like individuality. They were not afforded the luxury of mental health. They had to save their pennies and work and work and work. And so that hustle mindset is deeply integrated into the immigrant experience. And so there's a lot of shame around experiencing these mental health struggles. It's defeatist in a lot of ways. And so we believe that bridging that narrative and normalizing these things through our 4 main goals will really mediate that difference. Our number one goal, though, first and foremost for the mental wellness program, is access. We are trying to build relationships with schools. We actually, most of the individuals who are using our services come from Aurora, then Denver and North Glen. These are the main cities we serve, but just being able to get into the door of a mental health service provider and someone who's affordable. MYPI does have a fund to support individuals who cannot afford it themselves, as we're trying to build and develop some way to give more people access. Number 2 is trust. There was a quote in Avatar, The Last Airbender, and he said, the opposite of fear is not courage. The opposite of fear is trust. And so we're really taking an initiative to ensure that the faith leaders trust the mental health providers, and that the parents are trusting the faith leaders in this regard, and that the youth get to trust everybody. And when we say trust, we mean building a safe environment for us to express what is challenging, and to be able to trust that if we come to you and say, I think I have a mood disorder, or I think I'm suicidal, that you will not be shamed and turn away. This is a very, very key part, and it feeds into number 3, which I really think is number 1, and that's stigma. And we want to combat the stigma around mental health, but also around mental health providers through exposure, talking about individuals who've experienced themselves, through training and through education. There's a joke in the Muslim community that says, if you have a psychiatrist or a therapist tell you one thing, and then you have someone in a white coat tell you the exact same thing, they'll believe the person in the white coat. And so trying to figure out how do we turn the reality of the mental health experience? How do we stop stigmatizing it as a defeat internal experience, And then of course, empowerment, because there's no purpose to any of this if we maintain the victim mentality. And Muslim youth are resilient, they are strong, and they deserve to be celebrated. And so we try to use art as a mode of celebration for our youth. Given that they are at the intersection of several realities, from racism to classism to just xenophobia to being religiously estranged. Some of our students are a little behind because of what they've had to experience to get here. So you have those other barriers that could marginalize. So what kind of services? We did start this program about 1.5 years ago, and we went from having 0 Muslim mental health providers in our network to 7, including therapists, including people who got their PhDs. We're doing group counseling right now. We have family counseling. We even have equine therapy, religious and spiritual counseling for those who are struggling with that side of things. And we have a strong referral network that we believe should be tapped into by individuals in the greater community outside of the Muslim spaces. Because a lot of the Muslim mental health therapists came from the very communities that they are serving, and we understand how to navigate those tricky pieces that can really be frustrating to deal with on the outside. We also provide cultural competency training, particularly when it comes to working with refugees. We had a whole influx of refugees from Afghanistan, and it was a lot. The state was reaching out to us, being like, "Please help us. This is so much more." And so, being able to help the helpers to do the most effective helping, to make sure that we're actually doing the work and we're healing and serving in the right way. We also have in-house resourcing, teaching us, our own members, our own MYPI family, how not to internalize things like stigma, how to maintain your mental state despite some of the heavy stuff that comes in. We're dealing with underbelly stuff, secret addictions that we don't get to talk openly about, and it can really be heavy, but our motto is, this is heavy stuff, but we can carry it together. We have mental health workshops just to teach individuals about it from a scientific standpoint, a clinical standpoint, so they don't feel so connected to it. And so we take the education route in order to really ensure that people who themselves would not seek help are still able to have a knowledge base. Poetry and writing workshops. We have our mental wellness conference. It happens in December. Last year, we had 12 community organizations come with their tables. And so that is one amazing way to get involved, because we want to know about your services too. And then, of course, the Imam and Youth Connection, making sure that the mosques and the institutions are playing a role and making sure that we're all serving the youth together. Yeah, the best ways to get involved really is when there comes a situation, let us help. And there are things on the outside, and then there are things we talk about in the private room. There are issues that the community as a whole is ready to deal with face on, and there are issues that we as a community have to deal with in a delicate manner. And so we are so grateful that we've been in a position where middle school guidance counselors have reached out to us. They're like, we have a Muslim student, their family doesn't want them to do therapy, things like that. Can you help? We have individuals who speak their language. We represent over 20 languages and 20 cultures. And so ways to get involved is by letting us step in and help you. And also, if there are services that our community absolutely needs, we embrace filling the gap, and we want to ensure that all that we do is born out of the grassroots connection, and that we are able to walk over to each other as neighbors and really tackle these issues. Those suicide rates are scary, and it's getting tough out there, and the divide will get deeper unless we grow this grass and fill it with gardens. So we hope that you'll head over to mypi.org, and if you have any more specific questions, you can reach out to contact@mypi.org. Our mental wellness program is fairly new, and so we started from nothing, and now we are growing. And so there's a long way to go, and we have a lot of learning to do, and we have a lot of teaching to do. So I'd love to open up the floor and talk for a minute if anybody has any questions that we can answer in the meantime.
Thank you, Amal. Does anybody have any questions? Those were some great resources and really eye-opening statistics that you provided. So thank you for sharing all of that. Any questions?
I have one. If someone were aware of a family who could benefit from your services, what's the best way to do you have like a formal referral process, or how should they get in touch?
Yeah, as we're building the systems in the background, really email and phone call is the best ways. Mental.wellness at mypi.org is how we're beginning most of our conversations. You can send them our way, and if they need a human to talk to and someone who speaks their language as well, thankfully we have a library of people who can serve. But we can start with that email, and I'll pop it right down here in the chat box.
Thank you.
Yeah.
Oh my goodness, I'm blown away by your presentation and the services. And I needed, you just speak about a couple of cases that I have that I've been for months trying to get assistance. So I'll be in touch. But in terms of your geographical area, where are you? I don't know if I missed that in your presentation. I work with them in Denver metro area mostly. So, and outside too.
Our mental wellness program, since it was really, it emerged during COVID, most of our services are primarily telehealth. We are working to establish an office in Denver, in the city of Denver, to be as central as possible. But our service providers are around the city. We have from Fort Collins to Boulder, to Aurora, Centennial, you name it. So
fantastic.
yeah, we're very virtual right now, given the time we were born.
And is that for everything or just for the mental wellness program?
For those types of services. So for our equine therapy, for example, with the horses, that's in Parker, Parker, Colorado. But as far as our events goes, North Glen is one of the places. We mentioned Ikhlas Mosque, which is where we have our refugee center. So that's like closer to Lakewood. And yeah, and our events are scattered about. We try to do all our events in the city of Denver, our mental wellness conference in the city of Denver. So that's where you'll catch us. But for the most part, yeah, our website is home base for now until we get our office situated.
Okay, thank you, Mom.
You're very welcome.
So thank you so much, Amal and Stephen, again, for your wonderful presentations.
Thanks everyone for joining. Thank you, Amal and Stephen, for your presentations. Appreciate your time and energy and hope to see you here again.
Thank you so much.
Mm-hmm.